Hello, 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 everyone. Welcome to another episode of Sree's Global COVID-19 Show. My name is Sree Sreenivasan, and it's my honor to convene this conversation around various aspects of COVID-19. Today, we're talking about the vaccine, and this is episode 257, and we have two doctors who got the vaccine, and they are a father and daughter who are both doctors, and they both got the vaccine this week. We are super excited to have them with us. Dr. Kanu, who's an MD in pediatrics, and Dr. Krupali Tajura, MD in radiation oncology. And they will take your questions around the vaccine. Any question you have that they can answer, they will try to do so. And you can see the lovely tweet here on the screen. This is the happiest day of my life. Both my father and I got vaccinated for COVID-19. I'm a puddle of happy tears. You will meet the two doctors in just a minute. Hello, everyone. I'm Sree. Thank you so much for being here. This is going to be a wonderful program. We're going to learn a lot, and we're going to talk to both Doctors Tajura in just a minute. If you haven't seen the show, in our first 250 episodes, we were on every single day. Now we're on about once or twice a week. We've had more than 1 million viewers and 457 guests from 73 cities and 20 countries, including the chief scientist of the World Health Organization, Dr. Soumya Swaminathan, was with us. Our archives are on youtube.com/Sreenet, and we're in partnership with Scroll Global and Scroll.in. We're very grateful to our producers, Rose Horowitz at Rose Horowitz 31 and Vandana Menon, Vandana_Menon. Please follow them on Twitter. And please tell us where you're watching from. We're live right now on Facebook, on Twitter, on YouTube, and on LinkedIn. Please tag a friend, and then they can watch now or later. Please tell us where you're watching from. Please ask your questions. We're just delighted to have you all with us. And now I'm ready to talk about the vaccine and to ask about the vaccine of two doctors who just got the vaccine this week. So let's bring them both on the screen. As you can see from this tweet from Dr. Krupali, she's at Krupali on Twitter. And again, she got the vaccine, and her dad did as well the same day this week. So let's bring them both on here and thank them very much. And congratulations on getting the vaccine. Hello, folks. How are you?
Thank you. Thank you so much. I was very excited. I think my dad was excited too, right?
Yes, I'll be more excited because I was all senior, you know.
So thank you very much, both of you, for being with us. We'll ask you about the vaccine in just a minute, but Dr. Kanu, let me just ask you, how have you been handling the pandemic all of these months, and how are your patients and the folks that you treat and work with?
It is slightly difficult and odd, you know, because I was used to see the patients in the office, do treatment, talk, chit-chatting, and that everything changed all of a sudden. So more or less, I used to wear the mask, goggles, facial shields, if I had to see the patient in the office and keeping distance and with minimum exam. And as the pandemic grew, so we started doing on telephone conversation, and by this and
Telemedicine, yeah.
Telemedicine, and we used to treat by that, and patients were happy, and most of the children's parents were very much scared about their children, and they wanted about immunization. So for that immunization, we kept our office open.
Just for the normal immunization.
If they have got serious sickness, we used to send them to the urgent care and not to the hospital, because hospital was very dangerous.
Right.
With patients, so you have to take extra care.
Wow. So and then tell me how you came to get the vaccine? When did you find out you're getting the vaccine? Did you have any hesitation to get the
No,
vaccine?
we got it by email from the hospital, that Corona Regional. They sent me the email that the vaccination will be available for the professionals and working in the hospitals, for the emergency room, physicians, nurses, and allied workers. So I was able to get it.
That is awesome. And tell us about that day when you went in. Was it very crowded? Was it?
No,
Yeah.
our hospital, it was very well organized. They kept it outside the hospital in conference room, which was not attached to the hospital. And it was very well organized. They maintaining the distance, and the nurses were sitting far away, and there was the waiting room, and there was also observation of the patients after getting the immunization to make them wait for 15 minutes or more if they had any symptoms.
And how did it go? How did you feel? What was it like?
I was slightly tense because of this being a new vaccine, and a lot of things going around, and was discovered within a year. So a little bit and anxious and anxiety was there, but when they give, I felt okay. There was no anything to worry about.
Okay. All right.
Only soreness of the at the injection site for a few hours at night, and then it was all right.
Okay. Well, I'm knocking on wood here and hope it goes really well for you.
It was nothing there. It was, it was more or less, when they give injection, it was painless. I felt nothing.
That's great.
Just after a few hours, because pain starts after a few hours, and it doesn't last that long. Some people feel more, some less.
Okay. Let's go to your daughter, Dr. Krupali Tajura. Thank you for being here. Tell us how you've been handling the pandemic with your work. You're a radiation oncologist. Tell us what that is exactly and how you've been working.
So radiation oncology is a field where we treat cancer tumors and non-malignant tumors with radiation beams, and I deal specifically with adults. So since March, we've had many meetings on protocols and such. So when patients or people, including staff, we get, our temperatures measured. Everybody has to mask up at all times. Break rooms are separated for when employees need to eat lunch. And similar to my dad, I was very big on PPE, masking up, eye protection, since the virus can infect via the eye, along with the face shield. As a lot of the stuff that I used to do in person, follow-ups and stuff to give lab results, I have now converted more to telephone, and telemedicine is a big thing. But with new patients and new cancer diagnosis, obviously, I'm still seeing them in person, and we're still treating patients. At one point this summer, we had about 55 patients on treatment per day. So that didn't really slow down despite the pandemic. What my mantra was to protect my patients and my colleagues and my staff, to protect my parents, and then obviously to protect myself. Especially with cancer patients, you worry about their immunocompromised, ability with chemo and everything. So you do not want them to get this virus, which we really don't know a lot about, and how it could affect people with cancer and how they would respond to any treatment and such.
And so what were some of the things you learned along the way?
I think the things I learned along the way, obviously maintaining distance, washing hands. I think the whole sort of regimen of seeing patients became much more, more defensive medicine, where we're trying to keep everybody safe in a bubble. As the months progressed, we became more, and we got to know more about the virus itself. Although we still don't know it all, we know a lot. and just trying to protect patients. And so every time I would talk to a patient, whether it be in person or on the phone, I'd really emphasize the need for social distancing, hand washing, masking at all times, and to stay away from groups that are not living with you inside your home, and to not bring visitors in, and not to go eat with friends, because the moment you put your mask down and start eating, if your friend says a joke or your family member says a joke and you start laughing, you're exchanging molecules, which you can potentially get infected that way. So I tried to kind of it was more of also, teaching my patients about COVID and how to potentially protect themselves. So not only dealing with their cancer, but also dealing with defensive medicine on how to protect themselves and their family members.
Defensive medicine, that's a very evocative term. I know you also practice what you preach. You're in the home with your father right now, but you're in separate rooms, and
separate rooms, ventilation, and I always mask up around them. I don't eat around them. I eat outside. We eat at different times, because ventilation is key, separation is key, and masking works. I mean, there's data, and I believe in science and data, and so I have to trust it. That's my field, science. So
sure. I know that your patients are easier to deal with, I presume, than your dad's patients, who are children and parents of little children. Dr. Kanu, what were some of the hard things for your youngest family members to understand, your patients to understand, and their families?
My hard thing was to make certain that their children, when they go out, to make certain they wear the mask. And they used to tell me that they don't like it to wear to the children,
Right.
But we try to convince them as much as possible, And so I saw some of my patients, with even that they were as young as like 1 month. The mother when they used to come to the office, they put some mask on their face, which was very good. And others, I have to tell them, try to protect the children and don't take them out. And if they have to go out at all, to make certain they wear the mask too, because they can get infection too. They are not immune. So I have to tell them that besides them covering their mouth and nose, they should try to cover for their children too.
And it's hard for little children to understand. You saw the kind of horrifying story.
Children, yeah, they used to pull out, but then they have to repeatedly put back. But in my office, like when I had to examine it, at that time, I had to check their mouth for if they are having some cough or some other problems. I had to check their throat, then I had to unmask them for that.
Sure. Can I ask you, how do you think Delta handled the problem? You may have seen the story of a 2-year-old who wouldn't wear her mask, and Delta Airlines asked them to leave, made the parents leave the plane. Was that overdoing it, or was that the right call?
It's a double-edged sword. It was a right thing to do to protect others. If some children, they do carry the virus carrier, and so and they can infect others too, besides being themselves. So it was a right thing to protect, because at that time most of the data was not available, but like adults, children also are carriers of the virus.
Great. Folks, you're watching a wonderful conversation with two Drs. Tejura, Dr. Kanu Tejura, who's a pediatrician, and Dr. Krupali Tejura at Krupali. She is a radiation oncologist and also very active on social media. I hope you all follow her. And then she posted one of the most beautiful tweets of this period, where she talked about the happiest day of her life. So Doc, talk us through this, and then people have been asking questions and posting their comments, so we'll go to those as well. Everyone, please tag your friends. Please share with them. These two doctors got the vaccine, and they will answer your questions. I'll put a close-up on the tweet itself. Go ahead, Krupali, your thoughts on that day?
Oh, I was thrilled to get the vaccine. I had been calling my hospital and the places I work, when they were going to get it, because I couldn't wait to get it. The data that I read on both the Moderna and Pfizer, I mean, with 95% efficacy, I couldn't wait to get the vaccine. And so when I got the email to get scheduled, I cried because I didn't think that we would come to a day with the vaccine, and to have it within a year was mind-blowing to me. And they've been working on mRNA things for almost a decade, if not more. But, in April, I thought it would take a few years, and to have this opportunity to have it within the same year was just magnificent. So my vaccine, it was in the auditorium of the hospital, very well spaced out. You check in, they ask you a few questions if you're allergic to certain things, and then a nurse administers the vaccine, and you sit in an area where you're observed for about 15 minutes, and then you go home with your little card, and then you get scheduled for getting the second dose 3 weeks later, since immunity doesn't happen until about 7 days afterwards. And then even with the vaccine, even if you get the vaccine, you still have to mask up. Why? People are like, what do you mean you have to still mask up? Because you can still be a silent carrier and transmit coronavirus to others. So I don't want to hurt anybody. I do not want to transmit the virus to anybody, even though I may be immune. They may not be immune, because we are the first wave of getting this vaccine. So it's important to, continue to mask up, even despite two sets of, after the second set of vaccine that we get. I think it's going to be January 11th. We get the second vaccine, the second dose.
So it's about two things. It's about the fact that you can be a carrier,
a silent carrier, and not know.
And because you need that second dose.
And even after the second dose, you're still masking up, because everybody else is not vaccinated. And so they still don't have sort of a rule I haven't seen. I think you have to mask up around everybody. I think masks are into all of 2021, vaccine or no vaccine. And I think if everybody understood that, we're trying to protect each other, and it's out of respect for each other, because we are each other's neighbors, right? Everybody is interconnected somehow. The postman that comes to deliver our mail is, getting affected by what I say to him, our interaction, to what he goes home to. Everybody is interconnected. We are each other's own families. And I think respecting that would help us get out of this much quicker. We are not separate. We are together. We are one. And so, my concern, especially during this holiday, is in Southern California, it's sort of a war zone at every hospital. Every ICU bed is full. They're building tents everywhere. And people are still continuing to travel, to host gatherings, and I can understand the angst of not being with family members and loved ones at this special time. But, my mantra is, please sacrifice the holidays. Don't sacrifice your loved ones. Because I think that 3 to 4 weeks from now, what we see today, and we are in shock, it's going to be twice as bad. And if we cannot handle this wave right now in Southern California, I think every hospital is almost to their breaking point. What's going to happen in January? And that worries me. And unlike when the waves first happened, I think in New York in March and April, where doctors and volunteers and nursing came from all over America to help out, unfortunately, there's wildfires going on all over America this time. And so we're at a shortage. We can build more beds, but we don't have enough staff to take care of people. And that compromises care not only in COVID patients, but it compromises care in normal emergencies or normal circumstances, heart attacks, strokes, accidents. And so when these people come through to the ER, it compromises their care because there's not enough things to take care of them or people.
Wow, that is so worrisome, and something that we all have to be careful about. We have lots of questions and comments coming in. Let me just pull up one of these. Deborah asked, what about ivermectin. Do you know what that is?
I do not.
Okay, so people can look that up. Sorry. Let's keep going here. My father's watching in Kerala, India. I don't know if either of you have been to Kerala, but my dad says, good to hear from a doctor who has crossed the Rubicon. He says, you're getting the vaccine. Dr. Kanu, have you been to Kerala in India?
Yes, I've been to Kerala.
Okay, very, very nice. We call it God's own country.
Yeah.
In
Very
Kerala.
good.
Hi, Acha.
Yeah. Very nice.
Yeah, good.
Hi to your dad.
So now we have the two dads and the two kids on the line at the same time. Congratulations on getting vaccinated, father and daughter duo, says Geeta. She's watching from Memphis and says happy holidays.
Thank you.
Was that a coincidence that you both got?
Yeah, it was a coincidence because we both work at separate hospitals. So when I scheduled mine, I was so excited. I called my dad and I said, Dad, guess what? I'm getting vaccinated Monday. He goes, I just scheduled my vaccination too on Monday. And so, and it's such a relief because of his age group, he's more at risk than I potentially would be. And so I even wanted to give my spot up to my mother. I'd rather have my mother be vaccinated before me. I could wait a few months. That's okay because they're my parents, right? Like that's who I need to protect. But unfortunately, they wouldn't allow that. So, she would be she's over 75. So she would be in the next wave and we're going to figure that one out as it comes. So,
yeah, so they don't let you trade or
no, because I would gladly, my dad was even gladly like for mom, anything for mom, right? Ma, right? Mataji, like that's, so yeah, we tried to figure that one out, but wasn't successful.
In a way, isn't it good they don't allow you to do it? Otherwise, they would be like,
yeah, because I was reading some stories here in LA, especially, the Hollywood people are trying to donate money to hospitals in order to buy their vaccine right now. Somebody said they would donate $50,000 to a hospital if they could get a vaccine sooner. And that's not the way this works, because the people that need to get vaccinated aren't only the ones in healthcare, but the people who work at the grocery stores, the bankers, the post office workers, the bus drivers, the garbage collectors, the EMT, like all the people who have to be there and cannot work from home and have been servicing people for this entire pandemic need to get vaccinated. And this also includes, the restaurant workers. There's so many businesses, unfortunately, that have been impacted by this. And, my heart breaks because everybody needs this vaccine. And I don't think money buys you this ticket, and in order to flaunt the wealth and stay in your bubble. That's not how this works.
Well, I'm glad to hear that you agree that that is not the way it should work. Dr. Kanu, can I ask you, taking that second dose, how hard will it be to get people not just to take that first dose, but to take that second dose? Do you see a disadvantage in the Pfizer vaccine that it is 2 doses?
No, there is no any disadvantage because the immunity with the second dose will increase. So most of the vaccine which we get even in the childhood, there are 2 doses or 3 doses, So
you're optimistic about that?
Yeah.
I think logistically speaking, Sree, I think it's going to be difficult. I think we understand the immunity will build with 2 doses, but the logistics, I think if that's what you're getting at, would be it's going to be difficult. And, Moderna just rolled out its vaccine. So you want to keep Moderna and Pfizer and Pfizer. So those differences also have to be met as well.
So it has to be the exact same one, right? So
you don't go Moderna one day and then Pfizer the next 3 weeks, right?
So one of the things, as you know, in this country, we don't do a good job of keeping good medical records and getting people going for their monthly checkups or annual checkups, things like that. What advice can you give us as patients to take some control of this? Should we be calling our doctor and saying, in not yet because it's too early for most of us, but should we be calling and following up? Should we be better patients?
I think you will know when you know, and I think most of America will probably be in the line to get their vaccine. Per the new Surgeon General Vivek Murthy under Biden, he was just on Sunday, and he predicts probably end of summer, early fall for most people to get the vaccine.
Yeah. So at one level, that's good to know, but for some people, it feels really far away. I have a friend who is older than me who looked up the list and says, there are 150 million people in front of her. So how do you keep us going and staying masked and socially distant? And how do you keep us going when it's another 6 months of this, at least?
Well, we keep each other going, right? We're still going to be masking up with you. I'm not going to, just because I got the second shot, you're not going to see me on some plane traveling somewhere. That's not how we're all one community. So we're just going to have to encourage each other and keep each other in check. And these last few months have been difficult for everybody, mentally, socially, economically, spiritually. It's been difficult, and seeing my friends who are working in the ER and treating COVID patients, this past week, my friend who I went to medical school with, he had 5 codes within one ER shift. That's unheard of. Like the trauma also to the healthcare workers. There's a friend of mine who texted me. She said, "I've lost all the joy in medicine." And to hear that from her, it's heartbreaking what everybody is going through. We're not immune to it either. Just because we're working as a physician doesn't make us immune to the pain and the loss and the grieving that goes on.
That's certainly true, and thank you for sharing that. Let's look at a few more comments. Jonathan's watching from the East Village. Jonathan's watched 258 episodes in a row.
Jonathan!
Marcy is saying hello from Wildwood Crest, New Jersey. Hello, former guest on our show. Ellen says hello from New York City. Folks, if you have any questions, please ask. Stefan's watching from Ramsey, New Jersey. Congrats on the doctors getting the medicine. We have a question. Is it true that first shot gives you 80% immunity? The second is 10 to 14%. Is it necessary to take 2 jabs if that second is only 10 to 14%?
I would take the 2 jabs. If you're given a 95% in a life vest, wearing a life vest, would you take the 95% or the 70% if your life depended on it? You'd take the 95%. It's a no-brainer.
Dr. Kanu, your answer?
Yeah, same thing. Yeah, we'll take 2 doses.
Okay. Folks who've just joined us, this is father and daughter, the Tajura family. Both are doctors. One, Father Kanu Tajura is a pediatrician, and Dr. Krupali, who's his daughter, they're both in California, is a radiation oncologist. Let's go for some more questions and comments. Shubhalakshmi says, congrats to the wonderful father and daughter duo. Love that what Dr. Krupali says about all of us being interconnected like a family. Jan says, any updates on the other 10 vaccines that are in the works? We hear about Moderna, Pfizer, but there's so many others.
So ironically, one of my friends today just sent me a message. She's on the clinical trial for AstraZeneca, and she sent me a picture of her getting the second shot. So I think we're going to get more information about AstraZeneca, Johnson & Johnson. We just don't have it yet.
Okay. Let's go to some more comments and questions. We just have a few minutes left with our guests. Narayan's watching from Kolkata. Have you been to Kolkata?
Yes, I've been there.
Okay, very, very nice.
We miss traveling.
Yeah, we do, don't we?
And the boss place.
Suresh says he's watching from Florida, and Paula Kiger is watching from Tallahassee. Hi, Paula. Vijay says he's not a hospital worker, is asking when can he get it. Depends on the country. Depends on the
country. I think every country may have different, but country, age, occupation. So they kind of do a risk assessment, and that's what I think they're doing here or trying to in America. And it may change. I mean, I don't know how it will be different potentially January 20th when we get a new president, right? So, who knows right now? So, Fauci got his vaccine yesterday. He had the Moderna vaccine. On Monday, Joe Biden got his vaccine. It was the Pfizer vaccine. They're both equal. So if you're offered a vaccine, take one. It doesn't matter which one. So that's another point I kind of wanted to emphasize. They're both great.
But some people may prefer to take one that's only one as opposed to two.
These two are both two.
Well, they're both
Moderna and Pfizer are both two.
Okay, I did see. Thank you. I didn't realize that.
Yeah, so Moderna and Pfizer are both sets of two. And it honestly, I couldn't even feel it going in. And the only side effect I had a sore arm that night. So I took 2 Advil, went to bed, and it was fine. And so do not be afraid. I know this is a new vaccine, and things are on social media. It's either a good service or a disservice, depending on if it's fact or fiction.
Sure.
But also know that all these healthcare workers would not. There's, I think, 1.3 million have been vaccinated so far since Friday, from the latest thing that I read. They're mostly all healthcare workers. Why would we throw out our front line if it wasn't effective, right? If it was going to hurt all the physicians and nurses and respiratory therapists and pharmacists in America during a pandemic, why would they offer it to us first? Like, that wouldn't make sense. So if we are taking it, I think everybody else should feel comfortable taking it.
Jan says, thank you to all medical people on the front lines.
You're welcome, Jan. Stay safe, mask up, don't do get-togethers.
Yeah. And then Ellen says, I hear that if you're older, Moderna shot is better and offers more protection for seniors. Is this true?
I don't know the data on that, to be honest, because as I said, Biden got Pfizer as he's 76 or some, and Fauci's birthday's tomorrow. He turns 80 and he got Moderna. So and so I don't really think it's going to make a big difference.
Okay, thank you. And then there is a question of many folks, including African Americans, who worry about trusting the kind of larger medical establishment. We have seen studies about this, and we have a tweet here saying, please, all African Americans, take the vaccine. Don't believe the hocus pocus.
Right. And there's great doctors to follow on Twitter who have been taking, reins on this, African Americans. Dr. Cleavon from Arizona. There's Uche Blackstock. I mean, they've all gotten the vaccine or are getting the vaccine. I would not hesitate on your, via ethnicity and not get the vaccine. We're South Asian, we're getting the vaccine. I've seen people from every ethnicity, Asian, African American, Latino, Hispanic, everyone. Get the vaccine. If you are offered it, #, don't waste your shot. Don't lose your shot. Take it. Okay. It's a life jacket.
There is a history of, some scientific studies being done on African American Tuskegee studies and what happened to Henrietta Lacks. And even this week, we got information that the oxy pulse meter, right,
with the colored skin,
as well as dark skin. So there's this disconnect between our Black and brown communities in some cases and the medical establishment. And I believe the medical establishment has to work hard to gain.
And we have to do better as a I think, and not just in medical, but I think the world needs to do better.
Thank you. Jan is asking a question. Do you know anything about the Russian vaccine that allegedly is good for 2 years and isn't given to people over 65?
I don't know anything about it. I'm sorry.
Okay, no problem. And we also have a tweet saying those studies are sold, the Tuskegee and others, so don't believe the hype about that. Dr. Kanu, as someone who grew up in India, I'm sure you have stories about the importance of vaccines and how they saved millions of people in India when there was disease of all kinds was such a problem. Do you have one from your own childhood that you could share?
Yeah, when there was this cholera, this one typhoid, cholera was very common, and also the polio and smallpox. So the vaccination did help to cure it, So now in India, the polio is almost gone. There is no more smallpox. It was very, very dreadful disease.
Well, you're the right person. Yeah, you're the right person.
Like in 1955 or 50, there was some Hong Kong influenza outbreak. I was in Kampala, and my father used to say, this is a very dreadful disease. We survived because there was no any vaccination at that time,
Right.
But we
I wanted to
the extra care. And
I wanted to ask you, some people who grew up in other countries, on their arms, they have a mark of the vaccine that many people in America don't have. Why don't Americans have it? And why do other people have it?
that was for the this one for
Smallpox.
tuberculosis BCG vaccine, and
The
it
BCG
used to leave the
vaccine.
mark on the arm.
Okay, but how come Americans don't have that?
No, because there was no this one at that
It was
time.
wiped out here? It was not here.
Tuberculosis was cured here. It was not common,
Okay, good. So that's all.
very common in India and other places.
Exactly.
And we all had to be vaccinated.
Yeah.
And when I came here, it wasn't there.
Cherry watching from Kerala says, hope all well and safe by next year.
I hope so too.
Jan says the adjusted virus in England that is the new mutated virus. Will our vaccines? Can you talk about that?
Yeah, great question. So yeah, the new mutation, there's a few strands in it that are a little different. What I was reading and what I gleaned in the last day or two is that the vaccine will likely help with this strain, but Dr. Tom Friedman, I think he was the former head of the CDC. Yeah. He said, the more the vaccine mutates, the harder it is to keep up with it. So the less it spreads, the less it mutates. That's why slowing the spread is so, so important. And unfortunately, this time period of the holidays where everybody wants to gather, that just the timing is wrong. So again, please sacrifice the holiday and do not sacrifice your loved ones and your community.
Thank you. Jan says she has the BCG mark on her arm, so some Americans clearly do. And Narayan says, I think a lot of awareness campaigns have to happen in India and South Asian countries, or else a major chunk will just not take the shot.
I think an idea in India is for not only big politicians or cricketers or, Bollywood stars, if they do it publicly. I think they have pictures of Elvis and other famous people taking the vaccine back in the day. You need a good public health campaign, and we need that in America. So when, LeBron James gets his shot or Serena Williams gets her shot, when these stars get their shots and when they can advertise it, that would be fantastic, and do it publicly.
Yeah. Ellen says, I was given the smallpox vaccine on my ankle, so I wouldn't have a mark on my arm. My mom insisted.
Smart mom.
She was thinking ahead. Okay, we just have a couple of minutes left. I want to give each of you a chance to share anything you would like. Dr. Kanu, let's go to you. Any thoughts for especially, we have lots of people watching with young kids. Your suggestions about the quarantine and anything else you would like to share?
No, this vaccine, we have to wear the mask, keep the distance, and hand sanitizer. These are very important. And even after getting vaccination, we should continue to do this till the end of 2021. Because when more than 70 to 80% of the people should be immunized, then it will be more or less little bit safe. Till then, we have to continue to wear the mask. And keeping the distance.
Thank you. Dr. Kanu, just one more question. Did the pandemic at this point and where you are in your career, did you think at all about retiring, or did this give you more incentive to keep practicing?
No, I wanted to keep practicing till I can,
I tried to stop him.
I enjoy medicine.
You tried to talk him into retirement?
I did. At his age, but he loves medicine so much. It's who he is. And so, I can't get in the middle of his passion. And he's contributing to society, and he's doing the right thing. And so I'm very proud of him. He's my hero. And I'm fortunate to be able to say that.
It's beautiful. Thank you so much. And Krupali, your thoughts?
One thing about this vaccination, we don't know in future whether how long it's going to last.
We don't know how long the immunity is going to last.
So it maybe we might have to take a repeat dose after a few years or not. We don't know.
But how would we know? It's when some people.
The research is still going on. The research is still going on.
It is going on. So this is all we have to keep our mind open. So we have to start taking the vaccination and hope for the best. And
Got
we can hope this immunity lasts for lifelong, but we don't know. We might have to take at some intervals again to have a booster,
That's right. For tetanus and other things, you take a booster
So
shot.
maybe after 10 years or 5 years, we don't know.
Or we may have to take it every year like the flu, and that's okay.
Yeah,
It's a shot. It's not a big deal.
Okay, you folks have been great to hear your thoughts. Kripali, your last words for us.
My last words are, we are one, all of us, in every country, every nation, all colors, all races, all religions. Every being is one. We have to take care of each other. And I think this is sort of a test. And if we cannot, this is going to keep on prolonging. If we just work together and say, you know what, we're going to mask up, take care of our neighbors, take care of our community, we can get out of this quicker. And I urge everybody to please, please, please do so.
Beautifully put. Thank you, both of you, for your time tonight. And from the same house, different rooms, masks when you're together. That's just a great inspiration and example to all of us. Thank you for your time, and thank you all for watching. Please share this conversation. It'll run on all these channels right away as soon as we're off the air. Ellen says, thank you, very informative and interesting. And yes, my mom was smart. I can wear sleeveless dresses. Mark, yes, we are one. She is right. Narayan says, this was great. Thanks a ton to all of you and for great moderation. This is just great to have all these comments. And thank you to both our doctors. And
thank you.
We thank you.
Thank you, Sree.
To be there.
Thank you both, doctors. Dr. Tijora, so great to say that, both of you on our show tonight. And we learned a lot, and you helped so many people. So